This is the 5th Africa Digital Health Summit happening live in Lagos State, Eco Hotels to be precise, and it's really been an amazing experience being here. I mean, we've been talking about AI, we've been talking about everything concerning artificial intelligence and how it helps the healthcare industry, especially the primary healthcare and the community level. And most importantly, there is a theme that catches my fancy, which is how AI-enabled fundoscopy is accelerating care for malaria, diabetes, and hypertension at the primary healthcare level and the community level. It's been an amazing experience, having conversation with professionals, pediatricians, ophthalmologists, endocrinologists, who are very seasoned in the field of healthcare, talking to us about how fundoscopy, the test of the back of the eye, how you can view the back of the eye with the camera, and then you can detect early enough a lot of pathological cases going on in the body system of humans. So this is really amazing, and we at Nightingale Media are so happy to bring this to light. Right now, I'm standing with this amazing woman, Dr. Fumilayo Bankole, and she will be giving us some insights on this topic also. Thank you very much, Ma, for joining us.
Thank you very much. So in our discussion, we've talked about fundoscopy as a non-invasive method of making diagnosis by looking at the back of the eye and assessing the retina and seeing what is going on in the retina, because the eye, we said, is the window of the body. When you can see something going on in the eye, it means that other important organs in the body are also going through the same process. So fundoscopy that we are doing for detecting changes due to complications of systemic diseases in the body can be used to screen for early detection of conditions, can also be used to monitor progress, it can be used to take decision as to what next to do or to change a line of management in a patient. For instance, we talked about cerebral malaria, which is a very severe complication of malaria due to Plasmodium falciparum, and it's something that can be a cause of death. So when children come with cerebral malaria, they come in coma, and there's a need to differentiate if this coma is due to other conditions or malaria. So by doing fundoscopy, there are characteristic changes that we see in the retina that tell us that this is cerebral malaria. Once you see that, it is pathognomonic. And once you institute the right treatment, you will see that a situation that would have ended up in fatality, the same child, by the next morning may be sitting up in bed eating. Also for hypertension and diabetes, it is said many times that some people go about with some of these conditions, they don't even know that they're hypertensive or they're diabetic. So when you look into the eye, and you see the changes due to hypertension in the eye or diabetes in the eye, by then we are asking the patient, so how long have you been diabetic? And they said, no, I'm not diabetic. And that is the stage where you send them for tests, and lo and behold, they are diabetic or they are hypertensive. So fundoscopy is a very, very important tool that we can use for screening, for making diagnosis, for monitoring progress in treatment. And now that we're having AI-empowered fundoscopy, we are getting to the point where we can actually scale up the service of using eye examination routinely to screen, and also at the primary level. Because at the primary level, you don't have the skills in terms of manpower to be able to do fundoscopy ordinarily. But with AI-enhanced gadgets, we can actually train non-clinical staff, which we have done in some places in Lagos State. For instance, in my district, in Lagos State Health District 1, when we are screening for hypertension and diabetes, we have these fundoscopy cameras brought in, which they are handheld and very portable devices now that can be used, and we are screening them for eye complications of diabetes and hypertension.
Thank you very much. This is quite insightful, I must say. Thank you so much for shedding more light to this. And I must say that it is the future of healthcare.
It is the game changer.
It is the game changer. I like that. Thank you so much. Thank you.
My name is Osainho Ethel Chima Wongogo, a person living with type 2 diabetes and an international advocate for non-communicable disease in Nigeria and Africa. ADHS 5.0 came with a wonderful team this year, strengthening the health system through digital data and AI, which of course is a necessity to move Africa forward. The rest of the world has already moved on and doing very well, but we are still struggling. But with this topic and with what a lot of people who presented today has done, we know that Africa or Nigeria is moving towards the right position. So, and as a person living with diabetes and a person living with non-communicable disease, I know that this is going to go a long way to really improve and inform us to move our nation, Nigeria, to a better place. So I just, last year topic also was amazing. I was here last year. It was also very impactful, and I look forward to more of this collaboration from partners to support Africa digital health to do better and come up with more topics to improve our health system. Thank you.
My name is Stephanie Okbere. I head the Design for Health practice at Co-Creation Hub, and I'm really excited at the successful delivery of ADHS 2025. It's been amazing. This year, I'm particularly excited to be one of the key partners of ADHS, representing Co-Creation Hub. It's exciting to see the level of support that stakeholders, partners are actually providing to early stage innovators, understanding that innovation will drive the change that we need to see on the continent as it relates to health. Just to say big congratulations to every member of the ADHS team, the organizers, the LOC. You've done an amazing job. Well done. Looking forward to the next one, ADHS 2026.
My name is Mary Ozuriagolo, aka Roya the Radio Diva, reporting for Nightingale Media.